Hi there, I'm Lily. Welcome to the Vital Horse podcast. I'm a veterinary surgeon passionate about what our animals' behaviour can alert us to. I focus on nurturing the innate nature of animals to address the deep roots of health, well-being and vitality. Our relationship with our horses is an inextricable part of this. I am guided by what they show me. Many people say, if only they could talk, but they can tell us so much and we can communicate back. This podcast is about you being able to help your horse fully by finding out what's going on, deciding how best to help, and then doing this ethically and effectively. In this way, we can investigate and treat behavioural signs and underlying health problems, pain, or dysfunction in our horses while actually improving our relationship with them. Let's find out how. In this episode, I have Penny Thorpe with me as my guest to talk about hooves and trimming. Penny has 13 years' experience as an applied equine podiatrist covering the southeast of the UK. She has a BA Honours PGCE, Advanced Level DAEP, Level 2 Photonic Red Light Therapy, and Animal Reiki Level 2, and is also solo mumma to a 10 and 12-year-old and servant to 2 cats. Penny did my own horse's feet for many years, and then helped me with the rehab boarding horses, and has been a big inspiration for me as well in learning to trim myself. So I thought it would be great to have her as a guest on the podcast to talk about hooves and trimming and to have some questions sent in by you. So here we go, hooves and trimming with Penny Thorpe. Okay, Penny, welcome to the Vital Horse podcast. So we're going to do, this episode is a very broad topic on hooves and trimming, and we've had questions sent in which would probably keep us going for several weeks. So we'll see how far through the questions we get. I've been working with you for several years with my own personal horses and then with the rehab horses boarding with me. And we have very similar philosophies, I think. So we were going to talk through some stuff to do with my kind of thought framework of the 4 deep roots to horse health and well-being, because feet fit into all 4 of those. They're very overlapping subjects, but feet fit into all 4 of those. So there's husbandry for happiness, which is to do with their lifestyle and the management factors. And then there is movement medicine, which to me is the amount of movement and also the type, so how healthy that movement is. There is cultivating comfort, so if they're in pain with their feet or if they're in also mental, emotional discomfort, and that can come in with the trim itself. And then there is communication, compassion, and consent. And I haven't actually gone into this a lot on the podcast, but foot handling can give us a huge amount of indications as to their underlying state, maybe their body comfort and mental emotional, so whether they understand the process and how they feel, how their nervous system is doing. Did you want to maybe just give a little bit of background about your yeah.
Well, thank you so much for having me, Lily. This is very exciting, and I've absolutely loved working with you thus far, and I learn something new every time we have a chat. So it's very exciting to be finally sitting down and doing this. So I've been an applied equine podiatrist now for 13 years. My background, actually, my undergraduate was in art. So having always been horse mad, I was a school teacher for 7 years and then absolutely knew I had to work with horses. And by hook or by crook, I got into remedial training. I was always very interested in horses that other people had problems with. So by getting into I started off doing my Monty Roberts courses, and I went an apprenticeship with some Monty Roberts trainers, wanting to get into remedial horse training. And it was there that I came across the importance of feet, horses having sore feet leading to behavioural issues. And so to cut a very long story short, started training in order to find out a bit more about feet so that I could be a more effective trainer, and found out I really am not a very good trainer at all. However, on starting to look at the science of applied equine podiatry and taking those courses, I was absolutely hooked and just absolutely loved the knowledge, the information, you know, the training, learning about the feet, and just that huge world that opened up, and thought, actually, this is where I want to go. I've got a background in horse rescue as well. I worked in rescue for a while, and yeah, I qualified in 2013 at my level 1 and my level 2, I think in 2015 or 16. I can't remember exactly. I was having babies at the time, so it was all a bit mad. And really, I really see that as like passing the driving test, and then actually it's the applied side of going out, putting this into practice, that has just been a continuous learning journey that never stops. And with that, I trained in red light therapy, photonic red light therapy with Photonic Health, and I've also recently done my Reiki training, and all of that has fed into everything that I started learning right from the beginning, and so I now offer a mixture of all those practices when I see clients. So yeah, I now this is what I do full time and have done for years, and I'm really lucky to do it. Yeah.
Yeah.
Very, very excited to talk to you about it.
Yeah. And those other modalities, actually, the red light therapy, people may have seen the social media, the photos and videos of Literal boarding with me, because he's that's been really helpful for him.
Yeah. It's a fantastic modality, and it's, you know, there's still so much to learn for me personally with using that modality, and it goes so well with podiatry, and you know, being able to read the horse and connect with the horse on that level, and get that feedback, as well as being able to turn up at an appointment and have a variety of things to offer, because sometimes you turn up to an appointment and it's not the day for that horse to have his feet done. Absolutely. For whatever reason.
Yeah.
And it's brilliant to be able to have something else that to offer, and that, you know, there's so much we could talk about with the red light therapy, and I'm glad Literal has enjoyed it.
Yes, he definitely has. Yeah, that's a good point, because the feet, to me, the reason why I realised I needed to learn a lot more about horses' feet is because it is such a whole horse thing. It's not the feet in isolation. They're obviously important on their own as well, but it's not them in isolation. It's they've got such whole body wide effects, and often, so they're both a reflection of and an influence on the rest of the body. So that's quite an interesting thing, because there's a chicken and egg thing with what's going on elsewhere and what shows up in the feet, and how I think that we have to address both at the same time, really. Backwards and forwards, we might never know exactly which direction things are always going in. Sometimes it's quite obvious, and other times everything's obviously happening in concert. But there's all sorts of systemic signs that can sometimes appear and disappear with changes in the feet. It's just it's just a whole world, really. And going back to those 4 deep roots, it's more than just that appointment, isn't it, of the trim. There's so many aspects to hoof health, like your horse's lifestyle, how much movement do they get versus confinement, what different terrains do they walk over, how much exercise in what ways, their diet, the delivery of their food. Because I do the dentistry as well, there's a big connection between the function of their jaw and the alignment of their teeth and their hoof morphology and function. So but anyway, we we could go off on all sorts of tangents
when we start getting, isn't it? there's so, I think I want to go back to the cyclical element that you're discussing,
Yes.
because that is so fascinating. Because like you said, within the foot itself there's a cyclical element. So what the in applied equine podiatry, we're looking at hoof to foot balance. So we're looking at the health of the foot within the hoof capsule and the health of the hoof capsule and how they relate to each other. And we're setting up a cycle for success. So this is referred to, again, this is something I was taught by Casey Lapierre, is physiological sequencing. So physiological sequencing, whether you call it all that or not, is something obviously that you do in your work. And the way I explain it is, if you can divide the tissues in the foot into 3 categories. You've got the sensitive tissues, the dermis. You've got the insensitive tissues, which are dynamics, so the horn and the cartilage and the ligaments and tendons. And then you've got the static tissue, the bone. And physiological sequencing explains how changes happen within the foot. So that is a cycle where, unless there's been a catastrophic incident, the change will start in the sensitive tissue. It will start in the dermis. The horse's nervous system immediately will respond to a change in stimulus. That will then lead, if that stimulus continues, that will then lead to a change in the dynamic tissue. And the brilliant thing about that is that as a foot care provider, as a podiatrist, we can examine that dynamic tissue, and that's the bit that we can address. Obviously, with the sensitive tissue, that's something we can address too through lots of different means. And in doing that, we can then prevent changes from moving to the static tissue. So this is the order in which things happen, in which change happens. If we want to prevent change happening to static tissue, we can address those first 2 types of tissue within the horse's foot. So that's a summing up of physiological sequencing. You could also use physiological sequencing to see how stuff has happened. So how has this dynamic tissue become this level of this conformation? How has this flare happened, for instance? How have these underrun heels happened, for instance? And then use physiological sequencing, using that progression in tissue to help improve the health of those structures, and still protect, with the aim of protecting the static tissue within the horse's foot. So there's a cycle in that sense, and there's also a cycle in how the hoof relates to the foot within. So when I talk about hoof and foot, the hoof capsule is the bit you can see and you can feel, and the foot within is comprised mainly of the pedal bone and the ungular cartilage and coronary band that is within the foot that you can only see on a dissection, but that provides the foundation for the hoof capsule. And the hoof capsule stimulates that foot within, and the conformation and health of the foot within is responsible for what the hoof capsule looks like. So there's a cycle there that, as a podiatrist, you can influence by called the trim, which is the balancing of that hoof capsule and how it relates to that foot within. And it's so fascinating. I think only in the last 10 years, I think, we've understood more about how that relationship and the health of that foot influences the lymphatic system in the horse, and what a crucial role it plays, for instance, in health and healing, as you were saying.
Yeah.
So that's just one aspect of how impactful that relationship between hoof and foot can be. Stop there.
Yeah. Yeah, it's actually it's so exciting, really, that we can both read the hoof capsule so you can get a bit of an indication of over time what's been happening internally and with the loading of their limbs, of their digits, and then we can also apply something to affect or improve that. It's not just that their feet grow and we have to take a bit of material off.
Exactly.
There's a huge amount more to it than that. And I guess the other thing to say is that very traditionally long term, a lot of horses would have had rigid metal shoes attached onto their feet, and that kind of changes things in various ways. One of the ways that changes things is the circulation, because it becomes rigid, and then the foot, it doesn't, the whole unit doesn't flex and move in the same way and have the same kind of circulation, and also you can't quite read it in the same way. So if anyone's listening who's got shod horses, it's still really useful to think through, because obviously the hoof still works in the same way, but there are maybe some restrictions when there's a rigid metal shoe attached.
Absolutely. And once you can then understand what the anatomy of the foot is and what each structure is responsible for, you can then understand how making that structure rigid is then going to impact that horse, and make an informed decision. And very much, in my training, it's not about barefoot versus shod. It's about how can we help this horse and owner combination achieve the goals that they're looking for, and create the healthiest foot possible.
Yeah.
And I think that technology is coming on. There are lots of new types of foot products out there. Boots have made an enormous difference in horses being able to hack out comfortably and remain shoeless for most of their life. And that's a whole nother conversation, because I do have clients who are in shoes for a few months of the year because in rigid shoes for a few months of the year, because the demands on that horse is so enormous with what they're doing. And I feel it's I'm working in concert with the owner and the farrier to make sure that when the foot goes into the shoe, when it's time for them to do their endurance and the foot goes into the shoe, that foot is as healthy as possible, as well balanced as possible. And I know that if through working with the owner and with other practitioners, that to get that hoof in that foot in that shoe, it's going to lead to great success. And then when the shoe comes off, it's going to be easier to manage that shoeless period. And one thing that I haven't mentioned here, which is crucially important, is that this always happens as part of a team. This is always involving other practitioners and working together. And that is actually one of my favourite parts of the job, is having a really good team and learning from other professionals like yourself, physios, osteos, chiropractors, body workers, trainers. There's so many other people that it's really important that we're getting feedback from each other.
Yes,
I want to know that what I'm doing from their perspective is helping. And if not, then that's valuable feedback.
Yes, absolutely. Yes. Yeah. So shall we
get
some of the questions?
Yes.
Did you have one that you wanted to start on?
Yes. Thank you so much for the people who sent in questions. It's really important to keep us focused.
Really good selection of questions.
Really good selection of questions. And there's probably not enough time to get through all of them, I would think, because they were really good. So the first question is, how can you tell if a hoof is healthy and functional? And I think there was a second part to that question, but that is the first part that I think is wise to start answering. What a brilliant question. So initially on going to visit a horse for the first time, firstly, I want to know all about the background health of the horse, because as we've discussed, the foot is going to be healthier if the horse is healthier. And if there are issues there, if there's medical issues, if there's a history, that's going to immediately give me an idea of what we're dealing with. And a happy, sound, comfortable, healthy horse is what we're looking for. And when I go out to an appointment for the first time, I'll look at the horse before even looking at the feet, to get an idea of how that horse looks in their facial expression, how relaxed they are, looking at the whole environment, and almost in a split second being able to pick up, okay, this is where this horse is. And then obviously doing gait analysis, gait evaluation, and doing physical palpation before even then looking at what we can see in the foot. So I think what I'm trying to say is that it's a very holistic approach. Now, there are certain things that we do look for in the feet to determine health. And the first one really is do we have any infection present? And this is massively common to come upon a horse for the first time and they've got a long-standing thrush infection, for instance, or a long-standing long-standing central source system thrush infection. And so that is something that, a lot of times if I know I'm going to see a horse, and I'll ask them to send me some solar photos of the horse's feet, just so I can check if there is anything they can do before I get there to start treating infection before I even get there. So that would be the first thing to look at. In terms of looking at the health of the foot, well, determining which structure you're evaluating is really helpful to think, right, I'm going to look at the frog, I'm going to look at how healthy the wall is, look at how healthy the sole is. And in our training, we're taught to use a spectrum of usability, which gives actually a spectrum score as to the health of that individual structure. So you're not focusing just on one thing, because that can be really tempting, just to start zoning into one aspect of the horse's foot, to actually have a systematic way to evaluate the horse's health, the foot health. So starting with the frog, is your frog, we know that a healthy frog on the whole is 50 to 60% as wide as it is long. Now, there are variations with breed, but just as a general rule, that frog also has to have sufficient depth. So you can have a very wide, flat frog, and actually it's not got a lot of depth, and that will generally reflect that the cartilage, the ungular cartilage in the horse's feet, which is the foundation of the caudal aspect of the foot, it hasn't got enough health and structure. What does the wall look like? Have you got growth rings? Have you got flares? Are there cracks? And you can actually do a lot of evaluation just by having your hands on the foot. That's such an important aspect. Taking a digital pulse. This is something that owners can do every day with their horse to get a good idea of a baseline of where that digital pulse is. If you don't know how to check your horse's digital pulse, then ask your vet, ask your hoof care provider, because that's a really important aspect of checking, going back to physiological sequencing, the sensitive, the dermis, the sensitive aspect of a horse's feet. And that will change daily, it'll change within the day, it'll change after exercise, obviously. So when you are checking your horse's digital pulse, make sure it's a resting pulse when the horse has been stood for a while. And then you can look at things like, well, what are the heels like on the horse's feet? Does it look like they've got a good amount of heel? And ultimately, how do they feel on their feet? Because you can have a foot that looks beautiful, but if that horse isn't comfortable, then you're looking at perhaps some other issues going on internally. So there's lots of different aspects to determining if a foot is healthy and functional. And for owners, I would say the digital pulse and checking infection is the main two that you can do every day.
Yeah, two things that I wonder if we could talk about a little bit more are depth and flare, because I think a lot of so domestication puts quite a few restrictions on the way that horses are adapted to kind of maintain their bare foot. And so whether that's the amount of movement on varying terrains or diet and feeding, those I would say are probably some of the biggest factors that influence the feet in domesticated horses. I think lack of depth and flair are things that are often perpetuating problems in bare feet, and that's probably actually something that would be better with a visual aid than on a podcast. But
a bit tricky. Yes.
Yes.
Yeah, it's very visual and also very hands-on. Even a two-dimensional image is difficult to relate to. That is also, I come across that a lot, and I think when you're talking about lack of depth, I know what you mean, but for listeners, what I think you mean is the horse has probably got a thin sole.
Yeah.
There's not enough strength, and the property of the ungular cartilage is either weak, and or there just isn't enough ungular cartilage, that it hasn't been developed enough.
Yes.
And then that and flare goes hand in hand, because when you've got a weak foundation, then there is the force of the stride is encouraging lots of pressure in a particular part of the hoof wall that is encouraging that outward movement. And of course that can be coming from higher up as well.
Yes.
Looking at your whole horse evaluation, some horses that is something they deal with and it requires constant management. Other horses, it is just a case that they've got some flare, and once it's removed it doesn't come back. So again, that's coming into working as a team with body workers, because that is that's really important. So okay, so in terms of how do you assess if your horse's foot is healthy? Well, knowing that the ungular cartilage in the horse's feet, which is the squishy bit at the back of the horse's foot, again, we haven't got any visuals, but it's the part that forms the foundation to the back 2/3, back half of your horse's feet. And what you've got there is you've got the frog, and the foundation to the frog is the digital cushion, and either side of the digital cushion are the ungular cartilages. And you can assess the health of these by getting your hands on your horse's feet and having a really good feel and feeling how dense do they feel. Now, digital cushion, ungular cartilage requires a really good elastic potential, and that means that it can withstand the distortion of the hoof capsule, and it can retain its shape, and that is for the purpose of absorbing and utilising the energy of the stride and preventing that energy from too much energy from going to the joint. So in order to do that, it's got to have a sufficient conformation, and it also has to have a good quality of tissue. It's got to be able to withstand that distortion. Now, when you see a foot that is shallow, as you describe, and has a lot of flare, the chances are that ungular cartilage isn't strong enough. Now, the great news is that with looking back at physiological sequencing, ungular cartilage is a dynamic structure, and we can influence it, we can help it. And what ungular cartilage needs is a correct balance between hoof and foot, and then correct appropriate pressure. Now, when I say appropriate pressure, I mean that it's like going to the gym. So you don't start off at your 20 kilo weights or
Yeah.
whatever, you start off with something that's not going to cause the horse discomfort or pain. And applying pressure is going to increase, that's correct pressure is going to increase the density and the quality generally of that ungular cartilage. I'm talking quite generally here. But the great news is that when you do that, and that will result in greater depth in your horse's feet, because it's the ungular cartilage that is responsible for developing the horse's heel. And responsible for the positioning and the quality of suspension of the foot within the hoof capsule. So this is, again, going back to my training with the Institute of Applied Equine Podiatry, one of the very groundbreaking differences in the teaching from the Institute of Applied Equine Podiatry is understanding the role of the ungular cartilage and coronary band relationship as being responsible, one of the main structures that's responsible for that positioning of the foot, the joint within the hoof capsule, as opposed to it purely being the lamella, which is what was thought of and still is thought of in conventional and historical veterinary medicine and farriery. And it's great news because it means we can affect it, we can improve it. And when you're talking about flare, the flare is an imbalance. There's an imbalance between the hoof capsule and the foot within. So that needs to be addressed. And again, this is about the team communication, understanding the horse's background, understanding the medical history, and understanding what the body worker is seeing as well, and working together to make sure that what you're doing with the foot is going in the direction that you want to go in. Just one more little thing is when we are assessing if a foot and a hoof is healthy and functional, well, you also have to ask that question right at the beginning: what do you want this horse to do?
Yes.
Because there's a foot that's healthy and functional for a pasture turnout horse or for a hacking horse, and then it's a very different set of criteria when you're looking for a horse that wants to do some sort of high level performance.
Yes.
So that very much is an aspect of how you then assess that, establish what is going to be realistic, and communicate that and make a plan.
Yes. Yes, I actually just wanted to touch on that word suspension, because horses are, their whole body is like lots of series of systems of suspension, and so things that are going on higher up, they really influence the feet. So for example, if the structures in the horse's thinking about the front end, it's a bit of a buzzword, the thoracic sling, and it's probably best to explain that it is a muscular system, so that the front limbs of the horse are not attached to the rest of the body by any bony connection. It's all connective tissue and muscle, and that is actually supposed to be suspending their body between their front legs. And there is a lot of weakness and dysfunction in those, in that whole system, very complex system of tissues, which is often mirrored in the foot. And what you were saying as well about the kind of functionality for what the horse is going to be doing, if we're going to be making changes, if we think that the foot is currently not in the place that we would want it to be, we may have to restrict certain things, like, for example, adding the weight of a rider for a while, because that system of suspension has a capacity at any time which we can try and widen, but it may not be at that point at this moment in time until we can change that tissue's capacity. And the second half of the question, I think that this is a really good place to bring this in, is after asking how can you tell if a hoof is healthy and functional, it was, if it isn't, what are the most effective things owners can do in our horses' everyday life to develop hoof health? And what I'm really thinking of there is one is hoof hygiene. If we're talking about microbial infections, so that's a very regular cleaning out and the use of antimicrobial products on the feet. And then the other, which is maybe a bit of a bigger question and maybe a challenge, is thinking what are we expecting of our horses day to day, and what can we currently expect with their current hoof health? What's going to promote improved hoof health, and what might actually hinder that at the moment?
Absolutely, it's so important, and I think this is where, as a podiatrist, my job is so different to other hoof care providers, farriers, for instance. I will often come in and say, no, you can't ride this horse at the moment. And that's very different from a practitioner who feels their job is to make that horse usable as fast as possible.
Exactly that.
And I think it comes back to, owners taking that responsibility and being aware of what the consequences are of not taking that time that the horse needs. So that often happens. Your horse has got a deep central sulcus infection in all 4 feet. You cannot ride this horse, and I'm often the bearer of that bad news. Much the same as I imagine as a vet and as a body worker. So understanding what the owner is looking for in terms of goals, assessing the weight of the horse, assessing the weight of the rider is really important in factoring the spectrum of usability, which is the sort of scoring system that determines what that foot is capable of at this moment in time. It might be different tomorrow. Because it's assessing what that foot can do now within that horse's capability and comfort level, and that is always a holistic approach, because you're always looking at the weakest aspect and trying to protect that weakest aspect. So the horse might have a fantastic foot in lots of ways, but if there is infection present, then straight away that capability is reduced. If, for instance, the owner wants to do something that's beyond that capability, but looking at the conformation, looking at the horse's history, we think, okay, we can start to work towards that, but for now we're going to do this. Then it's communication between the owner, between the other practitioners, perhaps the trainer might have ambitions that are beyond what that foot can do right now, but if explaining why that is the case is very empowering. And I think another aspect of working in applied equine podiatry is being able to communicate between those various professionals. So the vet might have said one thing, and we've got perhaps even an MRI result or whatnot, and the owner's panicking because they want to do X or Y or Z. And what I hope is that I can offer a explanation of where the vet's coming from, perhaps where the farrier's coming from, and saying, okay, well, this is how I see it. How does that fit into the plan? Is this going to shed some more light on why the vet and farrier have got this particular opinion? Because I do understand where they're coming from. I was trained by a farrier, so I very much understand that what they're trying to achieve. But if I can add into this plan physiological sequencing and the importance of developing healthy ungual cartilage and how that can help with getting towards the goals, then we can say, okay, I think we've got definitely worth giving the first 3 to 6 months a go, and then reevaluating at that point and seeing how has the horse's body responded to this particular plan. And we were discussing before we started recording this the importance of time, the importance of as you say, applying something, so a balanced trim, for instance, applying maybe some making sure the horse is in boots when they need that protection, applying maybe it's medication the horse needs, and then seeing what has happened after 5 weeks, seeing what's happened after 6 weeks. How has that horse's body responded? Because they will all respond differently, and they'll all respond in a different time frame. So going back to the physiological sequencing, then sometimes it's only after 3 or 6 months that you can really get an idea of whether the plan is you're going to reach the goals that the owner wants to get to. And I think being very open about that in the first appointment is important, so that we are keeping things real and and obviously allowing the horse to show us how they're responding, and responding back to that. Listening to all the different professionals. Perhaps we need to get in other professionals. Perhaps we hit a point, and very often I'll refer to it with my owners as a plateau. Okay, so I feel after we've been doing this work for a period of time, I feel we're at a plateau. And I think we either then reevaluate the goals and think, okay, well, maybe the horse can do this, this, and this, but not this, and that's okay. Or if we want to achieve something else, then, or the horse just isn't happy, like we've done X, Y, and Z, but something's missing. It's time to reevaluate. It's time to go back and look at the plan and get another professional in, because there's something else going on here.
I've just been thinking about so many different things. I try not to go off on too many different tangents, but one really important point is comfort, because and going back to what you were saying about infections, for example, they are extremely common. It doesn't mean it's normal.
Absolutely. Oh my god.
So you might see them all the time. It doesn't mean that it's normal. And it's also quite common for horses to be actually in some degree of discomfort in all 4 feet, and it's difficult sometimes to recognise that, because they're not head bobbing lame on one limb, but they're actually quite uncomfortable on all 4 feet, whether they are barefoot or even perhaps in shoes. I think that we probably, as not just horse owners but also professionals, need to get a bit better at noticing that, because so foot discomfort or low level discomfort or actual soreness on all 4 feet can show up in various ways that don't necessarily look like a lameness. You can have a horse that seems lazy, you can have napping, you can actually have very spooky horse, you can have them being really picky eaters. There's things that might not look like they're the feet necessarily, and we need to keep that in mind. If I think about it in terms of comfort, structure, and function are all they all feed into each other. They're all needed for all of them to be healthy. If you don't have very good structure, you're not going to have good function. You probably don't have good comfort either. So if you think that your horse has, say for example, weak, I'm kind of using quotation marks, weak feet is a term that can be used. And especially some breeds like thoroughbreds are sometimes, they just have thoroughbred feet. That is not a point to stop, just to accept, to kind of settle for that. If they don't have good structure, they probably don't have good comfort either, even if you don't think it looks particularly overt. So we still need to be striving towards improving that. And then the other tangent I was thinking of going off on was talking about the different tissues within the foot and their function, because what I found massively increased my understanding of the foot is in vet school we are mostly taught about the foot as a static structure. So say for example you take x-rays, which of course foot x-rays play a really important part in a lot of plans for feet and in a lot of workups of lameness and that kind of thing. But it's very important to realise that the tissues that we're looking at on an x-ray are not everything. And looking at things like static angles also doesn't tell you the full story. So they're very useful, and they also have limitations. That's something I just wanted to say. And it's also really important to look at the actual foot. So sometimes with cases that I review or that come in for rehab, they may have had a lot of diagnostics, and the diagnostic report, those clinicians who have given the diagnostic report have never seen the foot or the horse. So it's important to marry the two things up. with what the actual foot looks like and what the horse is doing, their behavior and how they are responding. And then that dimension of time is so important. So often in one kind of appointment or review, you just don't have that view of how things are going to change over time.
Yeah.
And these things do take time. And it usually isn't the best idea to put a sticking plaster on, like you say, for getting to a certain intended use faster than the current structures can reasonably really absorb. So yes, that all really important points there, I think.
Very much so. I mean, there's so much here, but I think there's a word that's coming to mind, and it's harmony. And I did a lot of my training in France, and the training was all translated. And balance and harmony, I believe, are a very similar word. And so, you can have a horse looking balanced on an X-ray, but the hoof capsule isn't in balance with the foot because you've got a load of flare, for instance.
Yes.
So therefore you don't have harmony. And I think what we're looking for is harmony for the structures within the foot to all be working in concert with each other.
Yes.
That's how they were designed to work, and it's utterly fascinating.
Yeah.
And then that foot to be working in harmony with the bodily systems.
Yes.
And that is also fascinating with how they all correlate and relate to each other. And we just know so much more now. And that is really exciting. I'm thinking particularly of the digital cushion, for instance.
Yeah.
That was thought of as a passive structure for so long in veterinary literature. Now, obviously, if you're examining cadaver legs, for instance, that have been shod for many, many years, that structure has been it's been it's atrophied.
Yeah.
So it's not as well developed as it would have been in a healthy structure. So you can see how it was overlooked or thought of as a passive structure. And now we know that there's actually ligaments within that digital cushion. We know that the digital cushion has myxoid tissue, which can become collagen, I believe. So that is excellent, because we in improving the digital cushion, which is the foundation of your frog, we can then really help improve the overall health of the horse and make sure that these structures are all functioning in harmony. And this, it comes back to balance. It comes back to having a good balance on your horse's feet. And I think all the other things are crucially important, but you take one thing out, like balance, and I like saying you're banging your head against the wall, but that is what happens. Is it can just, you can put all the, try everything else, all the diet, but if the balance isn't there, that relationship between the hoof and the foot, then you're not setting the horse up for success. So is that the question thoroughly answered?
Yes,
we just created more questions.
We could do a whole episode on each question that's been sent in, I think.
Yeah, absolutely.
Yes, I think that's good.
Yes, this is what happened when I first started training, and I have to be really frank about this. Is when I first went into like I say, I was looking to be a horse trainer. I was very arrogant, and I thought, oh yeah, how difficult is it to trim feet? I can do this. And obviously, I have my own horses. I was like, yeah, I can trim my own horse's feet. And this is before I started training with the Institute of Applied Equine Podiatrist. And I was looking at lots of different schools. I was looking at barefoot trimming, all these different things. I thought, yeah, I can do this. And then when I started learning, when I started training, and the more I learned, I stopped. I thought, I don't have a clue what I'm doing.
Yeah.
I have no idea what I'm doing. And it can be very overwhelming sometimes when you know something's not right, you want to do something about it, and you start the learning process. I'm just obviously thinking from owners' perspectives. And all of a sudden you know, you think, my gosh, this is so overwhelming, but it's so empowering, even just to learn, you know, about the importance of having a healthy frog and
Yes.
frog spine, for instance. The frog spine being the structure that is inside the frog, the bit that you can see, the exterior frog. And sometimes if I'm doing a lecture, I think, well, if the only thing people come away with is going home and assessing, does their horse have a healthy frog spine? Well, then that's great. So yeah, it's endlessly fascinating, but ultimately, you know, keeping on top of infection, learning to take a digital pulse, using your hands to assess the horse's hoof wall, identifying things like growth rings, flare, and how comfortable your horse looks and feels. You know, what's their facial expression like? You know, like you say, that's, I didn't realise that about picky eating, that
Yeah.
can be a foot pain thing. That's, you see, I learned something new every time. That's really interesting.
Yeah, both Jaguar and Littoral, once their feet were comfortable, they'll eat
got
anything.
Isn't
Yeah.
that absolutely fascinating?
Also, I think that plays into not just the fact that they are experiencing some discomfort, but that they have gut inflammation
Of course, yeah.
from physiological stress, from
Yes.
being in
Yeah.
a certain degree of discomfort.
Of course. And again, it's cyclical, isn't it? So if their feet are sore, they're going to be stressed, and that impacts the gut. And I think, you know, I certainly don't give dietary advice because I'm not a dietitian, I'm not a nutritionist. However, if you know, if owners are asking, often I'll get asked, you know, what supplements do you feed? What should I feed a supplement for the feet? And you know, I'll say, well, it's all got to start with the gut. The gut's got to be healthy, because that impacts absolutely everything. So that is usually where I'll say, go and find the right information, refer to your lovely vet, your nutritionist, because getting that gut health is gonna be the step one. And that is constant as well, because the environment's constantly changing, the temperature's changing, and stress levels can massively impact, you know. So what I meant when I said I turn up on a yard and I can immediately, you know, you get a very split second, is you're reading the stress level of the horse, because that's going to give a big indication as to what you're going to find when you then look at the foot.
Absolutely.
Yeah, stress is not good. And of course, as we've discussed, horses in domestication are by very nature stressed, because they're around humans, and because we've, you know, altered the environment so much. So again, it's not to overwhelm people, it's not to depress anyone, it's just being aware means you can then make changes that are going to hopefully have a good impact.
Yeah.
Ready for the next question?
Yes.
Right, so the next question I have got is, have you got the list?
I've got the list of questions. I've got them in the order in which they were sent in.
Yes.
So I can go to the beginning one if you like.
That was about a specific horse.
It was.
It? Yeah.
Yes. Or there's some more general ones on trimming.
Yes.
So for example, what is the difference between barefoot trimming, which might be used as a term? Sorry, this is me interjecting in the question here in particular circumstances. So the question is, what is the difference between barefoot trimming versus a farrier that prepares the hoof for shoes? Does this have an effect on the horse?
Yeah, it's a great question, and I would say, in terms of the model that both of those practitioners are working towards, so a barefoot trimmer, mostly in my experience, I am not a barefoot trimmer, so I'm talking, you know, from an outside perspective, but a barefoot trimmer generally is using the feral horse as a model. So, you know, wild mustangs, brumbies, etc., as a model, as a baseline for their idea of what healthy foot looks like. And farriers are using traditional veterinary science and static mechanics as a basis for what a healthy foot looks like. whether they're putting that foot into a shoe or not, I believe.
Mm-hmm.
So both of those are kind of very different, and yeah, I find there's a huge variation within the two uh, practitioners as well. So you actually get massive variation with how each practitioner will treat
Yeah.
or sees how to balance, and that's a whole topic in itself. So that's not an easy question to
Yeah.
summarize. Yeah, you know, as an applied equine podiatrist, it's a radical alternative to the traditional farrier and veterinary sciences.
Mm.
Using the, you know, deep knowledge of and study of the physiology of the feet and the anatomy of the feet, the functional anatomy of the feet. So I can't really answer. I don't know. I don't think that answers the question.
Well, no, I think it does. Yeah, I think that's a helpful, like it's a helpful summary, and I would say, the first thing that I thought of with reading that question is, probably in terms of these sort of static versus more functional approaches. So if there's quite a lot in terms of remedial farriery, or I mean, of course, neither of us are farriers, so we can't exactly speak for the entire profession. But looking at how things tend to be approached is, I know that from my training in vet school that we got on farriery, it was all about angles and relieving or changing strains on tendons and what that does to the bony column alignment. Yes. There was very little mention of any living tissue. Right. So any, and that might have changed now because that was a lot. I mean, I've been a vet for 10 years, so it was early on in the course, so it might have changed now. And it probably also depends on the vet school and who's teaching it as well, as to how much things like blood flow are talked about, or like, say for example, I didn't know what the solar corium was for years, and so I would say that that's a difference that is striking to me, is looking at the functional aspects of more tissues, but not not really meaning to be kind of disparaging, I suppose, but just there might be limited usefulness if we're talking about maybe some form of rehabilitation of an injury or a weak structure or something like that. Yeah.
Limited usefulness as in
of just looking at static angles.
Of course, yeah, absolutely, yeah. And yeah, I mean, I can go into a whole summary of what static mechanics is and how that is applied, and how I believe farriers are taught to balance using the long pastern and the cannon bone angle, and using the T-square, which again is very different to how I'm trained. And I think I probably know more about, you know, the barefoot trimmer philosophy, because I started off by looking at that and very much getting excited by that aspect of oh, this looks, you know, really like this makes a lot of sense. And I think, you know, fundamentally it's about the fact that a feral horse is not a good model for our domestic horse. We ride our domestic horses for a start. Feral horses are usually much smaller than a lot of our domestic horses are built. And what we ask of our domestic horses is so much more. And actually, through studying the physiology and the anatomy and understanding the function of those structures, which is just so interesting, you can then be far more effective. I'm not saying anybody has all the answers at all. However, I feel very lucky to have had the training to have a model to work with, to work towards, and to always refer back to. So, you know, with continuous CPD, continuous learning, not only with the institute that I train with, but with other different practitioners, you can always then refer back to that model and refer back to the original teaching and the philosophies and principles, and think, well, how does that then affect that? So it gives a really good foundation. So yeah, again, I don't think I've answered that question at all.
Well, it's a massive,
it's a massive
subject.
It's a massive
there's
subject,
also a huge amount of variation within, you know, between practitioners and within those fields as well. And there's also huge advances in the field. So I mean, there's in the field of farriery, there are some really insightful questions and excellent research being done. And there will be variation between practitioners as to how much they apply, or the skill level. I mean, I know this in terms of learning to trim myself, is it takes ages. It takes ages to add a skill to, you know, to add to your skill set in that way. And so I think there's some patience and compassion that is needed for people. Need to have the time to develop that. So if a particular method is perhaps not serving your horse at the moment, it doesn't necessarily mean, I mean, there's a lot of vitriol online, especially in the world of feet.
My lord.
Not helpful, in my opinion, because the most important thing, I think, is to keep having those conversations and to not be terrified, to be able to expand your knowledge and if needed, change your approach or work with somebody else. Or
and that applies to all of us.
Absolutely.
Like I say, none of us have all the answers. It's really important to remain open and be able to ask questions and be able to have questions asked of you.
Yes, absolutely.
And sort of be able to sort of challenge your thinking and ultimately listen to the horse.
Yes.
You know,
if you think you know exactly what to do in every situation, pretty soon you'll have a horse that will humble you hugely.
and isn't that the truth? And it's an endless learning process, and that's so true. I couldn't say it better, really. I think as owners, we're demanding so much more of our practitioners, and that's a really good thing. And as practitioners, we can learn so much more from each other, and it's not about bashing anyone. And you know, I think any time, there was a question about how do I know I've got a good hoof practitioner, and this could be a good time to look at it. You know, I really say to owners to trust your instincts, trust your horse's instincts. Obviously ensure that you've got someone qualified with a reputable, you know, preferably long-standing body that has proven itself over time, that you can examine what has been learnt, and you can also see other horses that this practitioner is working on. Are they good communicators? Do they work well as a team? Are they willing to speak to other professionals and take on advice? Are they nice when they handle your horse and generally, you know, willing to work with you with your horse? Are they listening to your questions and trying to answer them? And not that I'm saying they have to be able to answer them, but are they willing to have that conversation? And you know, as a horse owner, I know what it's like when you get someone new out and you think, oh, how is this going to go? Because you know, sometimes by the time you've got the person out, it's too late. You know, they're already doing stuff, and you're like, and you know, I'm probably guilty of that. You're going out and thinking, right, well, I know better, so you know, I'm gonna tell them what it, you know. And it's really important that we're mindful as practitioners of what we're doing, and how vulnerable owners can feel, how vulnerable horses can feel at the first time of meeting a new person, and making sure that, you know, we're setting up a good relationship with both the horse and the owner as much as possible. I'm saying that thinking of some really naughty horses I've got in my head, thinking, oh God, we both dread it when we see each other. But you know, on the whole, I think owners need, you know, to trust themselves and really do your research, really look into this person's qualifications and their background, and you know, you know, if you're looking for a new farrier, find people who use the farrier and get some really good reports about that person and their approach, and look at the feet of the horses
Yeah.
and the comfort level, and yeah, and trust yourselves on that level. And I think there was also a question about trimming, doing work themselves.
Yes. Yes, it was. I'm interested in learning to trim my own horses. What is
Yeah.
the best way to go about it? I heard that people do a little bit at a time so they don't make major changes. And does this have benefits?
Okay, so there's two questions there. The first one, in terms of learning to trim your own horses, I think there's a lot to think about with that. You know, I think it's really important that safety is acknowledged and that comes first. I have turned up to places and, oh yeah, I've been doing it myself. I'm thinking, my goodness, you don't really know the danger you're putting yourself in. You need the right equipment. You need to make sure you've got someone with you, and putting safety first. So I would recommend that if someone is interested in working on their own horses, that they take a course with the Institute of Applied Equine Podiatry, and they do a 5-day course. Of course, I'm going to say that because I train with them, and I totally understand that there are other courses out there, but you know, to get a really good basis in anatomy and why you trim and why you balance each structure and how they all relate to each other, and to have you know, a method that you use is really good for learning. So you know, step 1, step 2, it's not guesswork. You're learning how to do things in a very methodical way, and to get that real consistency in your work. That I, you know, I can recommend. And I think if you are looking at courses, again, look at how long the institution that you're looking at has been in business. You know, avoid anyone who is, you know, is very fanatical, particular about any particular structure in the horse's foot, because we've just talked a lot about harmony. We've talked about the importance of all these cyclical systems working together, and respecting the anatomy that the horse has evolved with over tens of thousands of years. And I think if you come across an institution that has a particularly cult-like approach and that is quite fanatical, I would steer clear personally. And yeah, I think, yeah, you can actually go to the Institute of Applied Equine Podiatry and do a hoof owners online course, just for, you know, looking after your horse's feet, and obviously, you know, go from there if you want. So that is that's definitely the option that I would recommend. But you know, I think you, again, look at it and look at what you're looking for, and if you're going to then work on the horse, I feel that having done that, you'll have the right equipment, you'll have the right safety equipment, you'll have learned to get under the horse safely as well, and protect your body. You know, that's really important.
Yes, absolutely. Yes.
Because you might have the great skills, but if you wreck your body trying to trim your horse, that you're not going to be able to do much with it. And you know, that is something that, you know, you need to build up that sort of ability and muscle memory and whatnot. So you know, I trust that can give you a really good basis to make sure you're doing that correctly. And I think it is always important to have a qualified practitioner over you know, coming and visiting, and maybe you do a bit in between, or maybe you do every other visit to begin with, so that they can see what you're doing and make sure you're on the right track. Because I've done it myself, thinking that I could do it before I was trained, and then realizing like, oh, I really, really wasn't doing what I thought I was doing. So I'm not to put anyone off, of course. I understand some people live in very rural areas, and that's your option. So and absolutely, it's a great way to learn about the horse's foot, because being a very practical learner as well, when you get your hands on and you're learning how the balance feels when you're actually doing it, that is an incredible way to really learn about how all the structures work together. So, but yeah, just do your research.
Yeah, well, it's sort of an art as well as a science, isn't it?
It is, absolutely. It's Casey describes it as a healing art form, and it really is very much the case. Yes, and there's a lot of it, you're working with a knife underneath a horse. And that you need training to do that. You can't just go in with that and expect that to go well all the time, because it can be very dangerous for yourself and for the horse. So definitely get some really good, well established, well qualified training.
Yeah, I think that's really, we've covered a lot of really useful ground there, and the other questions that were sent in are all really about pathologies. So I wonder whether we should actually do another episode at some point about more, because this has been about some more general principles. And of course, in a podcast episode, we can't give you advice about an individual pathology in your horse's case, because we'd have to see the patient.
Absolutely.
Even even if you sent us details, we'd have to. It just doesn't work that way. But most of the other questions are about problems as opposed to more general principles. So it might be best to partition the subjects in that.
Very much so. Absolutely. Definitely. And again, we've covered so much here. We've probably stimulated more questions than answered them. But I hope that I hope there's been some
absolutely
enlightening bits.
Thank you so much.
Well, thank you for having me, Lily. It's been wonderful talking to you.
Great. If you're listening to this episode when it's released and you're in the area, Penny and I will be running a foot workshop on Sunday the 12th of July at my track system rehabilitation yard in West Sussex in the UK. We will be covering functional anatomy, things to look out for in terms of both health and less healthy feet, and I will also be going into the foot's influence on posture and the upper body's influence on the feet, so you can start untangling those influences. To book, email me at lily@nurturingnatureequine.co.uk, and the link will also be in the show notes. Thanks for listening to the Vital Horse podcast, where you can find discussions focused on helping horses in ways that combine scientific principles and evidence with compassion and understanding. Do subscribe if this content has rung true for you. To work with me in a way that honours both head and heart, check out my online and in-person offerings at www.nurturingnatureequine.co.uk. If you are facing problems or are trying to answer questions with your horse, remember that physical, mental and emotional well-being are inextricably interconnected, that there is a wisdom to nature and to the body that we can assist, and that cultivating meaningful relationships with our animal companions holds an important key to the well-being of all of us. Deep awareness and a compassionate process will enable us to find sustainable, ethical solutions. See you for the next episode and look forward to working with you too.